Hey guys, it's Dr. Dusty at Lafayette Vet Care Center. Your pet's scheduled with us to have a teeth cleaning performed, so I just wanted to go over what that would look like, what's actually done during a teeth cleaning, and what you need to expect afterwards as well. Teeth cleaning at the veterinary hospital is a lot like you going to your own dentist. A lot of the stuff is exactly the same. We start with full mouth x-rays on your pet to evaluate for any evidence of infection, cavities, resorption of bones, or tumors. Following that, we scale the teeth completely to remove tartar that causes bad breath, gingivitis, and infection of the gums and the teeth. Once the tartar is removed, we can adequately examine each tooth to check for any chips, breaks, pocketing between the tooth and gums, or foreign material in the mouth. Often we find teeth that are not as healthy as we would like on either the x-rays or the oral examination, and at that time we'll call you to discuss the best options for how to address less than ideal teeth. Those options may include a root canal, extraction of the tooth, insertion of a gel that helps seal pocketing around the teeth, or simply monitoring for future problems. We always try to minimize the amount of anesthetic procedures needed, so if extra work is needed on any teeth, we most often perform that right away with your permission rather than scheduling a separate procedure. If any extractions are performed, we will use dissolvable sutures to seal the gums after the extraction. They're very small and typically do not irritate the pet and do not need to be removed. After any problem teeth are addressed, we polish your pet's teeth and apply a fluoride treatment for prolonged protection. After the procedure, we recommend keeping your pet calm for about 24 hours to allow the anesthetic drugs to be completely eliminated from the system. After returning home from the procedure, we recommend you give small amounts of food and water, equivalent to 1/3 to 1/2 of a normal amount for the first 12 hours, as the anesthetic drugs can sometimes cause the stomach to be sensitive. If any extractions were performed, we recommend you either soak your pet's dry food in warm water before feeding or feed canned food for the first 7 days after the procedure. The anesthesia can also slow the GI tract, so don't be alarmed if you don't see a bowel movement for 2 to 3 days after surgery. After the procedure, your pet may be sent home with pain medications or antibiotics if needed. Many people ask us what they can do prophylactically to prevent dental disease after their teeth cleaning. My top recommendations would be dental diets, toothbrushing, and dental chews. We recommend Purina's DH diet because the fibers in the diet are formulated in a way that your pet has to bite farther into the kibble to break it. This simulates brushing the teeth and in my experience helps significantly in preventing tartar and decreases the number of teeth cleanings needed in a pet's life. Toothbrushing can be laborious, but it's by far the most effective route to prevent tartar for our pets. Make sure you use a pet toothpaste so it's safe to swallow. We specifically really like the CET brand because it's enzymatic, which means just getting the toothpaste on the surface of the tooth starts breaking down the bacteria and tartar rather than needing to brush for a prolonged period in a squirmy dog. Finally, dental chews can help significantly. There's a sweet spot, however, on what makes a good dental chew. Anything your pet chews and is done with in less than 2 minutes is not very effective in preventing tartar. However, chews can also be too hard. We see pets every day that chew on antlers or cow hooves that break their teeth and require extraction. So be careful when choosing a chew. CET again is a brand that's really good at making chews that find that middle ground of not being too hard or too soft. Last thing I want to cover is what to look for after the procedure to make sure there's no concerns that we need to see your pet again for. If you see bleeding from the mouth, that is normal in a pet that's had a lot of extractions, but it should only be very small amounts of spotting. Any dripping of blood, puddling of blood is too much bleeding after the procedure. Please let us know. Otherwise, if you see refusal to eat or drink, excessive lethargy, or any vomiting or diarrhea, please let us know and we'll be happy to help you and get you back on the right track. Thanks again for trusting us with doing your pet's teeth cleaning at Lafayette Vet Care Center. Please let us know if you have any concerns.